kung ano ba yung kanyang, ano ba yun, kung saan yung mga, ano niya, kung paano, pataas yung paa, whatever. That is your Snelling chart. Okay? And then your handheld Snelling chart or near vision screeners, this one. Kasi nag-download po ako ng Jagger's Snelling chart, kaya ito ang gagamitin natin. There is a mga number dito, yung mga meters ng ating eyes, so that your ophthalmologist know how thin or thick your eyeglasses will be, yung gagamitin nila. Okay? And then we have our, ay, may pen light pa tayo. Ay, may pen light ka? Use opaque card, kahit made of cardboard, yung maliit lang. We use that to cover our eyes when we are going to do our return demonstration. And then I have also this ophthalmoscope. So this is an otoscope. And this one is your ophthalmoscope. Pero may mga adjustment kasi. Ito ophthalmoscope. And then I have also gloves. I have already my pen light. And then my gloves. Sino pala ang may kwan sa inyo? Portfolios. Hindi pa kayo bumili? We'll cooperate with you. And the client will not will decrease her or his anxiety. Now this one, number 3, evaluate distant acuity. So, how are we going to evaluate the distant visual acuity? This is now the use of your Snelling chart. So, wala po kasi tayo yung kindly, Mr. Gabriel and Miss, ano pangalan mo? Hakla. Miss Hakla. So, when you are going to evaluate the visual acuity of your patient, now the client, for example, Mr. Gabriel is the client. So, how many feet away from the Snelling chart so that you can evaluate the visual acuity of your patient? It's 20 feet. Diba? So, Mr. Gabriel, kindly go there sa likod. Do you think there is a 20 feet from here to Mr. To Mr. Gabriel place?
None. None. No.
So for the sake of turning ano na lang, so Mr. Gabriel is there 20 feet away. Miss Hakla, kindly let Mr. Gabriel to read. You have to point letters, and then this one, in order that the visual acuity of Mr. Gabriel, he will going to close or cover his left eye so that ilan ba yung kanyang how many feet kung ano ang mababasa niya dito sa Snelling chart. How far? Okay? So, start mo, Mr. Hakla. Kasi masyado din ganito, malaki. So, sige na lang.
F, P, T, O, C, L, P, E, D, P, E, C, F, D, E, B, F, C, C, D, F, E, L, O, P, C, D, D, E, F, P, O, P, E, C.
Ano to? Ano ulit?
F,
Hindi, wag mo na ulitin. Ulitin mo at E.
D, E,
Huwag niyo sabihin
Just read kung anong nababasa mo.
F, P, O, P, E, C, L, E,
lang, okay lang. Diretso mo na lang.
C, T, P, D, F, L, E, O, E.
Okay, that's enough. So, your right eye, ano ang kanyang, what number ba? Ang kanyang, ano yung kanyang eye? Right eye mo yung unang bumasa, ano right eye? So, what letter dito sa number 8? P. Okay. So, now, nagkamali siya ng pagbasa dito sa letter P. Now, you are going to record that kung anong letters and how many feet away yung kanyang nabasa. Though ang number 8, that is a perfect score of 2020. But still, meron siyang pagkakamali dito sa kanyang 2020. It's not perfect for his right eye. So for your left eye, Mr. Giselle,
E, F, T, P, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, G, P, F, E, L, O, P, G, D, B, E, F, P, O, T, E, C, L, E, T, O, D, P, C, D, F, D, F, L, P, O, E, C.
okay, that's enough. So means, dito ka sa number 10, number 9, pero ding hindi mo rin ano yan. This is already a 20 over 15. Still, hindi mo na maano until 2020. So your left eye have a perfect score for your reading. Because 2020, that is a normal eyes, the acuity. Okay, but here, while your patient is reading this Snellen chart, you are going also to observe the behavior of your patient, especially the eyes, if ito, tayo sandali. Okay, now we position Mr. Gabriel 20 feet from the Snellen chart or E-chart and ask the client to read this line until she cannot decipher the letters or their direction. Ang di niya na-decipher na letter is the letters doon sa 2020. So there is still a not normal ang kanyang visual acuity. It's not a perfect score for his right eye. So dapat you have to document also the results that the right eye still there is a letter that he cannot decipher. Okay. So during this vision test, note any client behaviors like leaning forward, head tilting, or squinting that could be unconscious attempts to see better. So while I was observing Mr. Gabriel, still mayroon siyang squinting means yung gano'n yung mata niya to see that letters. It means meron siyang what you call this one? Behavior na hindi niya unconscious sa kanyang sarili. So, hindi pa rin normal ang kanyang paningin sa 2020. So, at 2020, normal acuity, yung talagang direction that you can really read all the letters until 2020. Okay. Next. Now, this one, perform functional vision test, light perception, hand movements, counting fingers at 1 foot, if the client is unable to see the top line of the Snellen chart. It means the top line of the Snellen chart is your letter E. So, if Mr. Gabriel can no longer decipher that letter E, now functional vision test, light perception, you are going to use now your pen light so that kung ano ba ang nakikita niya dito sa pen light. What if he can still see the light? And then yung counting hand movements, 1 foot away, then ganun mo lang yung mga hand mo sa kanya if he can still decipher yung mga galaw ng kamay. For counting halfway, and then you are going to show to him kung ilan ang fingers na ito. 1, and then 2. That's it. That is your counting fingers. And next, to determine a patient's visual acuity of children and patients who cannot read, a nurse should use yung e-chart. Yun yung nakita nyo kanina doon sa left side. That is your e-chart. Okay? Then next, ayan. Ito yung ating Snellen chart. Ito ay yung e-chart natin, or sa other term ito is tumbling chart. Okay. So, you are going now to ask the children, saan ba yung kanyang tatlong paa? Is it pataas or nasa right, nasa left? Para malaman mo kung meron din siyang ano sa kanyang mata. Though meron din siyang measurement din dito pag 2020 or 20/15 kung gaano ba kaano ang kanyang mata siya. Then next, this one, to use an e-chart, ask the client to identify the directions of the limbs, example, up, down, or sa left, right. So, for normal findings, normal vision is 20/20. A 20/20 visual acuity means that a person can see at 20 feet what a normal person sees at 20 feet. Okay. Normal na normal ka, if you can see in a, or if you can read a letters 20/20. Okay, then next. So your abnormal findings, if there is abnormal findings, myopia, or your impaired far vision, if the second number in the test result is larger than the first, example given is 20/40, the higher the second number, the poorer the vision. So if number 5, pag ano na yan, okay. That is your 20/40 dito sa ating Snellen chart. And then abnormal findings, another one, legally blind. Vision in the better eye with corrective lenses is 20/200 or less. Pag ano ka na dyan, okay? Next, evaluate near visual acuity. So, this evaluate near visual acuity, use this test for middle-aged clients and others who complain of difficulty reading. So this one, I have give the client a handheld vision chart or your Jagger reading card, Snellen card, or comparable chart to hold 14 inches from the eye. So Mr. Gabriel, kindly take your seat. And then, saan yung aking I have my Jagger reading card. So you let Mr. Gabriel to read 14 inches away. So from his eyes, ayan, this is 12 inches, diba? So mag-add ka na lang ng 2 more inches to make it 14. So, dalawa, 8. So where is the 14 degrees? We can do it. So, saan mo mababasa yan? Anong one mo dyan? 1, 2, 3, 4, 5, 6.
Number 3.
So, number 3, you can read number 3. Okay. Means that is now your measurement of your eyeglass, 0.62 m. Yun ang inaano ng ating mga ophthalmologists. That's why they are going to give you that how far yung nababasa mo, yung gaano kaigit. So that the ophthalmologist will going to measure now your eyes, near acuity, your near vision acuity. Okay, that is your younger reading. Okay? Next, this one, your normal near vision acuity is 14/14, with or without corrective lenses. So this means the client can read what the normal eye can read from 14 inches. Because at your age, imposible naman that you cannot read a small letter. Kayo nga, di ba, what will I say? Yung mga binabasa nyo dyan sa inyong mga cellphone ninyo, especially those who are fan of reading novel. Sinong nagbabasa ng novel? Okay, makikita nyo yun, di ba? Sometimes, kahit gaano kaliit, ginaganon mo yung cellphone mo so that you can really read. Pero pag ginanon mo na, there is something wrong with your eyes. Pag masyadong malaki. Yung 14/14, i-try nyo. But please, do not restrain your eyes while reading those novel. Medyo bigyan nyo rin siya ng pahinga yung eyes ninyo. Huwag natutok in 1 hour. Pagkatapos mo ng 1 hour, tumingin ka, gano'n is parang nabubula ka, di ba? So, after reading ng kahit 1 chapter lang, rest mo muna yung eyes mo. Para hindi naman maano. Ako nga, kung naglalaro ako, nakaganon ako, mamaya, tumutulo ako. Ano na kasi, pagod na yung mata. Okay? So, abnormal findings, we call this presbyopia or your impaired near vision is indicated when the client moves the chart away from the eyes of focus on the print. It is caused by decreased accommodation. A common condition in clients is over age 45. Kaya Mr. Gabriel, diretso yung 14 mo, di ba? Gumanon ka. So, if that 14 inches away from you, if you cannot really read, what are you going to do? Di ba, lalapit mo siya so that you can read. Okay. That is now your presbyopia. Impaired near vision. Parang ano na. Okay? Next, evaluate visual fields for gross peripheral vision through confrontation test. Ito na yung peripheral vision. What is your peripheral vision? Dito, di ba? Pag yung dito, sa ano dito? What vision? Pag diretso. That is your what? Central vision. Diba diretso lang siya? Dito yung peripheral mo. Pag ganyan. Okay, this one. Now, what part of the brain of your peripheral vision? What part of the brain? Yung peripheral vision mo. Is it into your temporal lobe, your parietal lobe, your occipital lobe, frontal lobe, what? Parietal, are you sure? Uy. Are you sure? Anyway, you can learn this into your other subject, pero ang ating peripheral vision is from our occipital. Okay, evaluate visual fields for gross peripheral vision through confrontation test. Now, Miss Hakla, kindly stay in front of Mr. Gabriel 2 feet away. Kunin mo na yung upuan mo kasi nakaupo naman siya. 2 feet away. So, iyan mo yung 2 feet away. Di ba masyado namang mamupan yun? Okay, now 2 feet away. So from the client, and then position yourself approximately 2 feet away from the client of eye level. Kaya dapat magka-level ang katawan. So how the client cover his left eye, Mr. Cover your left eye, while you cover your right eye, or you can close your eye. So you have to cover also your right eye, kasi siya left eye, sa'yo right eye. Okay. Instruct patient to fix their gaze on your nose using their uncovered eyes. So Mr. Gabriel kindly gaze the nose of Miss Akla. Na diretso lang ang tingin mo sa mata niya. And then, Miss Akla now will show her fingers kung ilan ba yung fingers na igaganon niya. But this time, the fingers of Miss Akla will halfway lang yung kanyang pag-show ng kanyang fingers. Okay. That is now your peripheral vision. So, okay, Miss Akla, kindly show how many fingers that you are going to show to Mr. Gabriel. Halfway lang, medyo ano mo sa peripheral niya. Kasi, ano ka sa kanya, gaze mo lang yung nose. Your eyes will not move to see how many fingers that Miss Akla will show to you. Okay, halfway means dito sa gitna, dito ka sa gitna. Medyo ano mo siya ng konti, ganyan. Titignan mo siya. Okay, how many fingers, Mr. Gabriel? 2. And then, itaas mo ng konti.
5.
Okay. Okay, when you are going to show your fingers, do not show in this way, yung napasay. You are going to show really the fingers para she or he can count how many fingers she's going to see. Okay, hindi mo naman gaganyan na huwag mo kukubaran yung isa. Pakita mo talaga. Kasi peripheral vision ang tingin. Kasi yung sa kanyang central vision is direct. And then, igaganon para yung kanyang peripheral vision can see how many fingers. Or, ano ba ang ginagawa ng fingers? It is yung nagaganon ba? That is legal. Okay? Next, do the other way. Yeah. Then, left eye kasi right eye na yung cover. Okay, another one.
1.
But di ba imam? Kailangan ipakita mo siya. Okay, that's it. That is now your peripheral vision through your confrontation test ng covering one eye at a time. Okay. Test the remaining visual fields of the client's right eye. Ayan, nagawa na. Repeat the test with the other eye. So when you are going to have your record demonstration, it's not only your left eye or your right eye that you are going to test, but both eyes. Para naman may silbi naman yung isang mata mo, yung isa lang, ay hindi mo naman pala alam na mayroon yung diferensya. Diba? But I think there is one student, parang hindi ko lang alam na may ano yung isang mata niya. Okay, so the normal finding is the client should see the examiner's finger at the same time the examiner sees it. So parang nag-anuhan lang silang dalawa. Hindi lang si client that can see his peripheral vision, but also the examiner can also see her peripheral vision. Silang dalawa. Okay, next. Abnormal findings, delayed or absent perception, reduced peripheral vision, client should be referred for further evaluation. If your client cannot tell you how many fingers at yung bang medyo ano siya, alanganin siyang magsabi na isa lang yung kanyang fingers. Eh isa lang nila ganyan-ganyan, they show. And then ang nakita niya is tatlo, there is something wrong with that. Diba? Pag lima yung fingers, sasabihin niya isa. So you're going to advise now your client na magpakita siya. Okay. And then, this time, check now the corneal light reflex. That is your number 6. Using a pen light, observe parallel alignment of light reflection on corneas. So, hold a pen light approximately 12 inches from the client's face. Shine the light towards the bridge of the nose while the client stares straight ahead. Note the light reflected on the corneas. Okay, is 1 foot away. So, you are going dito sa kanyang bridge of the nose. Now, you are going to observe kung saan mo ba nakita yung light sa kanyang cornea. Observe mo. Ayun o. 1 foot away. 1 foot. Hindi, malayo yan. Hindi 1 foot yan. Ay, Nick, ako din mati. So, 1 foot. Okay, doon sa kanyang bridge of the nose, masyado na ito malaki. Yan, 1 foot. Okay. Ako ba ang pagkukuy ng So, asan ang light? Can you see? Hindi ito wala. So, yeah. Okay, tingnan mo kung saan mo, ma'am. Both the eyes, tingnan mo kung saan mo makikita yung light. Diretso mo. Dito na. Yan, ilapit mo lang. Okay, yan. Asan yung light? Sa kanyang left and right eye. Are they equal? Yes. Equal sila. Nasa gitna silang parehas. Okay. Straight mo rin. Hindi siya. Siya ay ikaw mag-ano. Oh, can you see? Asan yung light? Equal ba? Symmetrical na dapat yung eye must be at the center of the pupil. Makikita mo yun kasi. The cornea, ninano natin, but the light must be symmetrical. Yung left at saka yung right eye, makikita mo yung light na nandun silang dalawa sa may pupil. Okay. Okay, ito, pero there is, eto lang naman kasi this is just, pagtingin mo na lang naman ng kwan yun, ma'am eh. It's not yung So, ang normal findings, the reflection of light on the cornea should be in the exact same spot on its eye. And then, which indicates parallel alignment. Parehas lang sila. Okay, next. Asymmetric position of the light reflects indicates deviated alignment of the eyes. This may be due to muscle weakness or paralysis. So, teka, mayroon akong papakita sa inyo. Sorry, nakalimutan ko yung gawin.
Corneal light reflections are a crude way to judge ocular alignment objectively. Have the patient look at your light. A reflection of the light will appear in the cornea of each eye. If the eyes are properly aligned, the reflection will appear slightly medial to the center of the pupil in both eyes.
Center of the pupil.
You will now see what the corneal light reflections look like when the eyes are misaligned. In esotropia, or inward misalignment, the light reflection appears displaced laterally in the non-fixating left eye. In exotropia, or outward misalignment,
Ito,
the light
nasa
reflection
cellphone yung
appears
isa,
displaced
yung
medially
isa
in the
nandito sa
non-fixating left
gilid.
eye. In hypertropia, or vertical misalignment, the light reflection appears displaced downward in the upwardly deviated right eye.
So ayan ang ating mga abnormal findings if you are going to do the light corneal reflex. Or what I mean corneal light reflex. And there is something wrong talaga. Talagang meron niya kasi talaga yung ocular movement. So ipapakita mo siya. Okay. Or I will, ito yung pictures.
The light reflection appears displaced medially in the non-fixating left eye.
Okay, let's go now to the next. So, asymmetric position of the light reflex indicates deviated alignment of the eyes, and then this may be due to muscle weakness or paralysis. So now here we have now to perform the comfort test using an opaque card to cover an eye, observe for eye movement. Okay, this time, wala tayong opaque card, but you can use now, ito na lang, kinayang-yang. Okay. Now, Mr. Gabriel will now cover his right eye. Ilalagay mo yung opaque card na. Yan ang card. Now, this time, Miss Hakla will going to observe the left eye of Mr. Gabriel. Tumingin ka lang dun sa, ask the client to stare straight ahead and focus on the distant object. So, kunwari, titignan mo na lang yung poste doon kasi wala namang makikita. Ay, tignan mo na nakapukot, makapukot. Okay, you are going to observe at a distant eye with an opaque card. Now, as you cover the eye, observe now your uncovered eye for movement. Tignan mo yung kanyang uncovered eye. If there's any movement, tignan mo. Observe. No. And then after that, tignan mo yung kanyang, papatanggal ko yung kanyang na-covered eye. Now, remove the opaque card and observe the previously covered eye for any movement. Tanggalin mo yung opaque card. Is there any movement? Wala. Okay, do to the left eye, Mr. Ana. Okay, cover the left eye. Observe now the right eye, Ms. Hakla. Then, remove the opaque card, Mr. Gabriel. Is there any movement also to the covered eye? Pagtanggal niya yung opaque card. Means, it's still normal because there is no movement between the two eyes, both the eyes. From uncovered to covered and then remove, pag there is no movement of both eyes, normal pa rin siya. Okay, next. So, repeat test on the opposite eye. So, nag-ano siya, opposite, both eyes na test ni Ms. Hakla. Okay, next. Normal findings. The uncovered eye should remain fixed straight ahead. And the covered eye should remain fixed straight ahead after being uncovered. Okay, so means normal yung mata ni Mr. Gabriel. So, the abnormal findings, the uncovered eye will move to establish focus when the opposite eye is covered. Teka, titignan mo yung ano ba yung
test is a test in which we cover deviating eye or fixating eye or both eyes alternatively to identify phoria and tropia. That means with the cover test we can identify phoria, whether it is exophoria, esophoria, hyperphoria or hypophoria, and tropia, whether it is esotropia, exotropia, hypertropia or hypotropia. This test can be performed at near at 33 cm and at distance at 6 meter. During the near cover test, patient fixed at 33 cm and during distance cover test,
Yan.
Have the patient look directly at the target at least 10 feet away. Cover the left eye and watch for a movement of the uncovered eye. Repeat this step a few times. Then do exactly the same thing in covering the right eye. If no movement occurs in the uncovered eye, the eyes are aligned. Here is a patient with esotropia. The left eye is deviated inward. As the fixating right eye is covered, the left eye moves outward to pick up fixation. As the non-fixating left eye is covered, there is no movement of the already fixating right eye.
Exotropia. Tingnan yung
There is a
movement.
patient with exotropia. The left eye is deviated outward. As the fixating right eye is covered, the left eye moves
This is a
inward to
fixating
pick up
eye, miss.
fixation.
This is the normal eye. Now, nagkaroon siya ng yung kanyang
As the
ayan.
non-fixating left eye is covered, there is no movement of the already fixating right eye.
See?
Here is a patient with a left hypertrophy. The left eye is deviated upward. As the fixating eye is covered, the deviated left eye moves downward to pick up fixation. As the non-fixating left eye is covered, there is no movement of the already fixating right eye.
So that is na pag normal na, pag i-cover mo, yung kanyang abnormal na ay magiging normal pag nakubaran yung normal. Pag tinanggal mo ito naman ang pag-ano, di ba? Magiging abnormal siya. But, if you are going to remove yung abnormal na mata niya, babalik yung normal, pero yung kanyang abnormal mata will also go back. Diba? Parang si endo pupunta dito, then si exo palabas, and then si hyper pataas. Okay. Same. The uncovered eye will move to establish focus when the opposite eye is covered. When the covered eye is uncovered, movement re-establishing focus occurs. Next, either of these findings indicates deviation in alignment of the eyes and muscle weakness. Okay? Phoria means misalignment that occurs only when fusion reflex is blocked. And tropia, or alias your strabismus, constant misalignment of the eye. What is strabismus in Ilocano? What is Ilocano in strabismus? Kayo marunong kayo magduling kahit normal ang mata nyo. Ako kahit wala kang tinitignan, marunong magduling. Hello? Diba? Kahit wala kang kasi yung iba, they cannot do the strabismus without this, okay? Yan ang laro namin nung maliliit kami, kami yung elementary. Kasi wala kaming gadget. So, naging nilalaro namin mga ganito. Kaya yung ano ba yung touching, yung rubber band, yung marbles, shadow, tumbang preso, yun ang laro namin. Kaya, no? Ano lang kasi pag yung weak ang muscle nyo, kaya nagkakaroon sila ng mga strabismus. Di ba doon sa amin? Okay. Esotropia, inward, turn of the eye, cross eye. exotropia, outward turn of the eye, and then lower eye. That is now your esotropia. Yung kanyang right eye, napunta sa loob. And then yung exo, yung kanyang right eye, napunta sa labas yung isa. Then, this one now, let's go now to perform position test to assess eye muscle strength and the cranial nerve function. So there are 6 cardinal positions of gaze. Okay. So here, instruct the client to focus on an object that you are holding approximately 12 inches from the client's face. Nasa iyo yung yung pen light. Okay. You can use that, Miss Hakla. So, 12 inches. Then, move the object through the 6 cardinal positions of gaze in a clockwise direction and observe the client's eye movement. So this one, Mr. Gabriel, remind the patient that only his eyes and not his head must be moving during this test. Inaantok ka, anak? Are you sleepy? Are you sleepy? Okay. And then, Mr. Gabriel will only move his eyes, not his head, while the object is moving. So your 6 cardinal gaze, your 6 cardinal gaze are your superior rectus. When you say superior rectus, is an upward movement. Superior rectus. Your cranial nerves here, yung nagpa-function na cranial nerves nyo is 3, 4, and 6. That is your cranial nerves that is moving now. Then, superior rectus, that is your upward movement. Inferior rectus is downward movement. Medial rectus is inward movement. And lateral inward, that is your medial, inward, and then your lateral rectus is outward movement. And then the other one, superior oblique, that oblique is downward and outward. When you say downward, outward, superior. And then inferior, baliktad yan. Inferior, upward, ito downward and outward, yung inferior. That is your 6 cardinal gaze. Your superior rectus, your inferior rectus, your medial rectus, your lateral rectus, your superior oblique, and inferior oblique. Thank you, ma'am. So this is now our Snellen chart. Ganito kalaki po yung ating babasahin. Bakit yung binasa ni Mr. Gabriel, kaya medyo yung kanyang 2020 visual acuity. Pero pag ito na ang babasahin niya, I think, hindi na niya makikita yung dito sa 2020. Kasi may eyeglass ka, di ba? Ano yun? Pangano lang? Anti-radiation. Astigmatism. Akala ko pang pogi points lang. Okay, that is now your cardinal your cardinal positions of gaze. So now we are going to do the position. 6, dito sa 12 inches. You have to, ito na lang, hindi naman yung sinabi yung thick eh, yung buong part. Pen line. Now you go first to right upper or dito sa ating superior rectus, right? When you are going to show this one, always dito sa middle and then right. Right upper. Sige, right upper. Okay, ganyan. Hindi ganyan nung kasakal iiyon si mo. Ito nung sa hawakan mo yung gitna. Okay. Saka na dyan. Ako, hindi mo sa banana. How to peel the banana? Ha? When you peel the banana, ganyan siya. Diba? Pag virgin ka pa. Hindi na nakahawak. Ganyan. Pag hindi nakahawak ka lang, ganyan na. Okay. Pagkamihan, you have to follow your eyes will move. Right upper, sige, right upper, then middle, and then left lower, and then middle, and then left upper, then middle, and then right upper and right lower, then middle, and then middle, middle, and then middle, and then lateral. So always right, and then at the middle, and then left, and then middle, and then left, then middle, down, then middle, then middle. Always, parang sa station ng train na magbibigay sa pinakagitna, diba? That is how you are going to examine or check the gaze. Right, and then middle, and then left, upper, middle, right, lower, middle, and then middle, then para yung gaze niya. Titignan ninyo kung ano yung position ng kanyang mata. Malay nyo yung isang mata niya is may pagkaduling pala. Sa taas. Okay. Next. So the normal findings, eye movement should be smooth and symmetric throughout all 6 directions. So, what did you observe, Ms. Hakla, to the eyes of Mr. Gabriel? Smooth ba yung pag-move niya? Walang difficulty, Okay. So, if there is the abnormal findings, failure of the eye to follow movement symmetrically in any or all directions indicates weakness in one or more eye ocular movement or dysfunction of the cranial nerve that innervates the particular muscle. Oy, ang tetics ka dito, kung kuburam, makita, the tetics you are sending messages. Okay, abnormal findings, nystagmus, that is an oscillating shaking movement of the eye, may be associated with an ear disorder, multiple sclerosis, brain lesions, or narcotics. While you are doing that position, yung sa 6 cardinal, pag nakikita mo yung kanyang movement ng kanyang mata, there is oscillating or nagkakaroon ng jumping parang gano'n, there is nystagmus on the eyes of your patient. Okay. Now, let's go now with the inspect eyelids and eyelashes. Okay. Here we are going to inspect eyelids and eyelashes. O, tignan mo na yung kanyang eyelashes. Ang ganda ng eyelashes ni Mr. Gabriel. Ay, di ko nataga, ang parpa rin tuman. Sino saan yung gumagamit ng ano ba yung pag-ganon ng mata? Ano? Third eye. Ako nagaganon din ako noon. You know what happened? Pati yung aking lid na naipit. Nasugat tapos yung kanit-kat na nagadugot sumurot. Kaya hindi ko rin makumat pa ako. Siyempre, pag dalaga ka naman, pag hindi. Diba? Pagandahan mo kita. And then, meron akong kwentong ganyan. Tapos, kasi, naaralan muna ako sa Baguio. And then, siyempre, nagdadalaga ka naman, 17, 18, kailangan mo din yung mga pag-beauty. Then, it so happened that I used pencil. Pero hindi pa sa kilay ko. And then, I used that in my eyes. Dito sa akin, not in my eyes, dito lang sa lids. Then, nakita ako ng tsahin ko. Nagano siya ako. Bakit? Ano bang nangyari sa mata mo? May sumutok ba sa'yo? Sabi ko naman, ay hindi, ante. Sabi ko gano'n, ganyan ang mga ganyan. O bakit yung mata mo lang nilagyan mo? Dapat pati yung sa baba nilagyan mo rin. Ano ba naman, ante, yung mata lang naman ang nakikita, hindi naman nakikita yung sa baba. Gusto niya pati doon, lagyan ko daw ng pencil. Gusto naman, sabi ko, pambira. Kasla ka na bruha. Wala na kung nakitikan niya ako. Nga mo ni auntie mo to, para napapahiya ako. Ganon. Tapos, akit ka ulit. Di, siyempre, dalaga ka nga. Mahaba naman ang buko. Dalaga yung suklay. Tama na yan. Pag gusto mong magsukli, kunin mo yung salamin. Habang nakasakay ka sa jeep, gugano ka sa phone, salamin. Kaya simula nung hindi na ako naggagano kasi lagi niya ako inaano yung auntie ko. Okay. Inspect eyelids and eyelashes. And then let's go now to width and position of palpebral fissures. So, asan yung palpebral fissures ninyo? Is that your palpebral fissures? Your palpebral fissures is how yung sa kaano ng mata mo, kalaki ng mata mo, ano ba yun, kahaba. Dito, from the outer campus to the inner campus. So usually, ang measurement dito, horizontally, paano yung horizontal, di ba ganon? O pag ganon, ang horizontal.
Paidap.
Pag ganon, horizontal, akala ko pag ganon. Pag ganon, that is vertical. So the measure of your palpebral fissures horizontally, the normal is 3 cm. Pag vertical, yung sa taas is 1 cm. Ewan ko lang yung may malalaking mata, yung kagaya ng ano. Pero usually, ang normal is 1 cm vertically. Horizontally is 3 cm. Okay. So, you are now going to inspect also kung ability to close eyelids. Tingnan mo nga yung close eyelids mo, Mr. Close your eyes. Anong nakikita nyo? Is it normal ba pag close nyo yung kanyang eyelids? Parang ano ba? Nagkadikit. Kung mag-discuss kayo dun. Siyempre, pag yung stress, lock na lock yan. Diba? Alam nga, Pinalit-ulit yan. Okay, you close your eyes, you cannot see any space, diba? Pero there are persons na kahit anong gawin mo talagang kakabuka yung mata mo. Parang nanginginig. Especially, tingnan mo yung mga deep, yung mga nakatulog na yung deep sleep. Makikita nyo talaga na parang bang may sinisilip sila. O kaya kung nga rin natutulog, may tinitignan sila. Diba? Yes, meron talagang gano'n na person. Kasi yung may side, pag yung mga ano daw, mga iris is moving, parang nananaginip daw sila. Kasi parang tutulog sila yung mga hindi ko lang naano na yun dahil hindi na natin touch yung mga Now, direction of eyelids in comparison with eyeballs. So, kailangan titignan mo rin yung eyelids. Tamang-tama ba doon yung eyeballs mo? Hindi ba kayo naka-usling ganon yung eyelids mo? It means there is something wrong. Pag nakakpan naman yung eyelids mo, nakatumnal in Ilocano. But, it means yung eyeballs mo, eyeballs hindi yung yak balls. Okay, eyeballs. Pag flat na gano'n, it means normal. So you have also to observe the color, if there's any swelling, lesions, or discharge, and also turnings. Turnings. Parang turnings. So inspect now the eyelids and eyelashes of Mr. Gabriel. What can you see? The eyelashes is thick, di ba? Maano kanyang eyelashes. And then, sabi ko nga yung straight ba yung kanyang eyelashes, hindi ba curve ba? Okay, next. So the normal findings, the upper lid margin should be between the upper margin of the iris and the upper margin of the pupil. Margin yung kasi yun na ganun. Talukap, di ba may ano din dito sa baba? Kasi may mga eyelids na diretso, wala silang ano dito. Yung mga ibang Chinese, di ba wala silang
Korean.
margins yung kanilang mata. Mga Koreans, di ba mga ganun diretso yung mga ganyan talukap nila. Unlike us na meron pang margins talaga yung sa ano ng ating mata. And then, the lower lid margin rests on the lower border of the iris. So lower, deep ito. Next, normal findings, no white sclera is seen above or below the iris. And then, palpebral fissures may be horizontal. Alam mo naman yung palpebral fissures mo, vertical na gano'n, ang klase yung mata mo. Oh, di ba? May palabas na gano'n, vertical yung kanyang fissures, di ba? Yung mga ginagawa nilang mga animal. So, palpebral fissures, longitudinal openings between the eyelids. So your abnormal findings, if there is ptosis, that is dropping of the upper lid due to oculomotor nerve damage, myasthenia gravis, and then weakened muscle or tissue, or a congenital disorder. So another one of abnormal findings, we have also the retracted lid margins, your hyperthyroidism, entropion, inverted lower lid. So abnormal findings, sorbiolong or your sty, in Tagalog, kuliti, and then local redness, swelling, and pain of the eyelid, and then chalazion, extreme swelling of the lid with moderate redness and minimal pain. So, yan ang ptosis. At di ba yung mga may ibang ganyan, yung kilit na sinasabi natin, yung Ilocano. Saka ganyan sa ano ng mga. Pero na kung nakilala na gano'n. And then, ayan, ang eyelid retraction. You can see the right eye. Nakabukhang ganon, pero yung isa is normal. Then, that is your entropion. Entropion, dito sa baba. Instead na doon sa taas, dito rin sa baba siya. And, your external or your sty, internal. Yung mga kuliti dito sa baba, yan po. And then, yun doon sa taas, and then yung sa doon. Chalazion. Masakit din yan if they are going to move that. Kasi naka-capsulated, then they are going to, naganyan din ako kasi ako noon. So, they are going to anesthetize first para hindi mo maano, and then karusan dapat iwan to the basket tapos karusan. Masakit din sa ano ng mata. Okay, external eye structures. Now, Mr. Gabriel, dumagan. Inspect. We are now going to inspect positioning and eye alignment and alignment of eyeball in eye sockets, noting protrusion or a sunken appearance. Now, inspect now the eyeball, the eye socket. Ano nakikita mo? Is it normal? Wala bang protruding? Wala bang sunken? Wala. So, normal ang mata ni Mr. Gabriel. So, symmetrically aligned in sockets without protruding or sinking. And this is now the abnormal findings. exophthalmos, protrusion of the eyeballs accompanied by retracted eyelid margins. Some can appear severe dehydration or chronic wasting illnesses. So this is now your exophthalmos. Lumabas yung kanyang
Eyeballs.
eyeballs. Diba? Wala na siya sa kanyang normal na displaced because of hyperthyroidism.
Maraming Facebook na nabasa.
And this is sunken eyes, dehydrated. Kaya pag ikaw ay dehydrated, tignan mo yung mata mo pag baka limus. Minsan umiitim din yung ating mga mata pagka doon talagang dehydrated ka. Okay? And inspect the bulbar conjunctiva and sclera, clarity, color, and texture. Now kindly inspect now the bulbar conjunctiva. So, your bulbar conjunctiva is a thin, translucent membranes that covers the sclera and inner lining of the eyelids. Your bulbar conjunctiva, you can find that, or you can, into your eyeball. That is your bulbar conjunctiva. Yung thin, translucent, yung putita sa ating sclera. Makikita mo din yan. Tingnan mo kung may any swelling, any redness, or whatever to the bulbar. Also the sclera. Your sclera is, anong yung sclera? That is your white, diba? The white of the eye. That is a dense connective tissue of your eyeball. So, kita mo na, is it normal? Tignan nyo nga yung mga kakabili nyo kung ano na nangyari sa mga mata. Baka may naantok na dyan. Next. Okay, have the client kept his head straight while looking from side to side and then up toward the ceiling. Observe quality, color, and texture. So, head straight and then tumingin ka sa taas. Tingnan mo yung kanyang bulbar conjunctiva. Then, baba. Look down. Okay. So, is there any lesions? The color. What is the color? Yellowish blue. Pag yellowish na, jaundice na siya. O kaya talaga yun ang kulay na zombie. Ipatato, may kang tato na. Kadamungan ka na. Ikatato na. Okay. So the normal findings of your bulbar conjunctiva is clear, must be moist and smooth, and then underlying structures are clearly visible, and the sclera is white. Clearly visible, nakikita nyo talaga yung nasa loob din. Mga arteries na maliit ay basic. Okay. So, another normal findings, bulbar conjunctiva is the cover of your sclera and then consists of transparent red blood vessels and ito na, pengicula, yellowish nodule on the bulbar conjunctiva, harmless nodules common in older clients. Hindi ko lang alam kung meron na kang yellowish din sa akin kasi older clients sabi niya eh. And then darker skin clients may have sclera with mga darker skin, siguro yung mga ating mga Nigerians, yung mga ganito sila siguro. Okay? Yan ang pengicula. Yellow, yan ang tao. Okay? The next, abnormal findings, there is conjunctivitis, that is a pink eye, generalized redness of the conjunctiva, and areas of dryness associated with allergies or trauma, and then bloodshot eye, dilated bulbar conjunctiva. Bloodshot eye, so and episcleritis, this is a local infectious inflammation of your sclera, usually characterized by either nodular appearance or by redness with dilated vessels. Yan, ang ating conjunctivitis. As you can see, pink eye. And the normal eye, yung dry eye, makikita nyo, yung dry eye, nakikita may redness dito sa kanyang bulbar, conjunctiva. Diba? Yung isa is clear na white. Okay? And bloodshot eyes yan. Bloodshot eyes. Trauma, isa na pag nabubugo ka, especially sa mata. Huwag naman, you have to protect your eyes, especially kung mga nabubugo kasi kung minsan dahil din ang mga sakso na okay? And next, that is your episcleritis. Yan. The south side. And let's go now to inspect now the palpebral conjunctiva. Your palpebral conjunctiva, this is, you are going to invert your upper eyelid is usually performed only with complaints of eye pain or sensation of something in the eye. So do not invert the upper eyelid pag wala siyang nararamdaman. Pero alam niyo ba kung paano niyo i-ano yung mata niyo sa taas? Oh, nalaro ko rin yan nung sekretary ako. Kala niyo pa, paglilisan. Yung iba ka, gaganon lang yung mga talagang naglalaro yung kanila. Pero nga, hindi ko na kaya. Kasi kasakit na rin ang part of my eyes. Kasi tumatanda na. Di ba, ganunin mo lang. Pero gawin ko. Lalo mo dito sa taas, and then hilain mo yung eyeliner ko. Pero talaga ba, hindi talagang pagpabilisan kami noon yung pagbaliktad ng lupa. Kasi wala kang magawa eh. That's part of ano ba,
Ay, nakapala na video?
Okay. Then, next. So, first, inspect the palpebral conjunctiva of the lower eyelid by placing your thumbs bilaterally at the level of the lower bone, orbital rim, and gently pulling down to expose the palpebral conjunctiva. But if you are going to do that, always use your gloves. Kasi you do not know if the eyes of the patient, yung mga minutiae, para hindi kayo ma-infect. This is to protect also yourself. So, inspect the palpebral conjunctiva of the lower eyelid by placing your thumb. Sige, ano mo siya? Tignan nyo, yung mga kakabili nyo. Palpebral. Ikaw, ano yun?
Ganyan na lang ako.
Sige, tignan mo. Bilaterally. Tignan mo yung kanyang palpebral. Meron ba? Baba, yes, you can pull. Pababa, huwag mo naman hilain na gano'n na. Gently pull down. Dito sa high orbital ring, gano'n mo siya. Itignan mo lang naman doon sa kanyang palpebral conjunctiva. Pag pink, dapat bright pink yan Pag nagpuraw sa tangkod, ay hindi na. Hindi ko lang sa cyanosis, kurang patikman. Okay. Sabi niya, dito is gently pulling down to expose. So, if you are going now to examine or inspect the palpebral, you are going to do that. Okay? Ano mo lang siya. You are now going to inspect. O, sige, nakita mo na. Kasi siya naman kasi ang Next. Ito, avoid pressuring the eye and ask the client to look up as you observe the exposed area. Now, ito, move mo ulit. Then, ask your client to look up. Titignan mo, sige. Look up. Taas mo. Peran. Its color is bright pink. Lukuraw sa'yo mo ka. Kung panilagan na. Idara. Then, ano naman siguro yan? It's not exactly that unless like you feel something. Okay, that is now your palpebral conjunctiva. And the normal findings, the lower and upper palpebral conjunctiva are clear and free of swelling or lesions. So, makikita mo rin lang naman ito kung kahit hindi mo naman igaguluhan ng palpebral, pagkasakit yung kanyang mata. Maano mo rin talaga na mayroon lesions or swelling. Next, abnormal findings, cyanosis of the lower lid. Ayan, cyanosis of the lower lid, heart or lung. Naluloko yung mga ko, naman Then, ito, yung conjunctival cyanosis, that is yung palpebral conjunctiva. Yan. Then, number 15, we are now going to inspect the lacrimal apparatus over the lacrimal glands, lateral aspect of upper eyelid, and the puncta medial aspect of your lower eyelid. And so the normal findings must be no swelling or redness should appear over areas of lacrimal glands. The puncta are visible without swelling or redness and are turned slightly toward the eye. So, dali, meron akong papakita. Ayan. Where you are going now to palpate. Yung lacrimal gland is dito lang sa upper eyelid. And then, superior lacrimal or yung mga pungka, yung pungka na sinasabi dito sa superior and dito yung sa inferior. Can you see? And then, teka, masyadong malaki. Yan. Lacrimal sac, nandito lang sa tabi ng ating mata. And inferior, superior, pungka yan. And inferior lacrimal, parang yung kanyang, and yung nasolacrimal duct, nandito lang. Sa baba na at sa medyo taas ang lacrimal duct. Okay? So, when you are going to palpate, use your thumb. Teka, wala pa tayo sa palpation pala. Sorry. Nasa inspection. So, the puncta are visible without swelling or redness and are turned slightly toward the eye. So, if there is abnormal findings, swelling of the lacrimal gland may be visible in the lateral aspect of the upper eyelid, and the cause by blockage, infection, or an inflammatory condition. Yan, ating lacrimal gland swelling. Yan, mata-mata na. Swelling, you can see, lacrimal dito, sa may side. May swelling siya. You are on the right eye. Swelling. Then next, if there is abnormal findings, redness or infectious or inflammatory condition. And excessive tearing, nasolacrimal sac obstruction. Okay. So now, we go now to palpation of your lacrimal apparatus. When you palpate the lacrimal apparatus, you must know also if there's any drainage from the puncta when palpating until to the nasolacrimal duct. Okay, can you kindly palpate the lacrimal apparatus sa mata, upper eyelid, lacrimal, yeah. And then, puncta, sige lang, yan, may masakit ba? Ito lang yung lacrimal. Then, ang puncta dito sa taas, and then dito sa baba. Then, sa baba, puncta, and then into your lacrimal duct. Sabay ang puncta na yung Can you feel any pain, sir? So, when you palpate and then no pain at all means normal. Pero pag na-palpate mo, there is pain, there is something wrong into the ducts. Especially into your nasolacrimal duct. Or into your puncta, if there's any drainage, pag palpate mo gano'n, may lumabas na it's not exactly siguro tears naman whatever na drainage yun. You are going to observe what is the color of the drainage. Okay? Siguro pag ko naman clear means yung kanyang luwak. Yes. Then next, put on disposable gloves to palpate the nasolacrimal duct to assess for blockage, and then use one finger and palpate just inside the lower orbital rim. So when you say one finger, palpate just inside the lower orbital. Sala. Then to the other side. Para i-palpate mo siya. Kasi pag dalawa na yung ginamit mo, it means walk. Pero kung sa orbital rim, sala. Then to the other. Huwag mo masyadong i-pressure yung kanyang panang-eyes. Ano mo lang nang gently palpate. Kasi pag there is any lesions or swelling, you can feel it. Okay? And even the client will say, mas masakit po yung part. Then next, the normal findings, no drainage should be noted from the puncta when palpating the nasolacrimal duct. So no drainage, Then, if there is abnormal findings, excess drainage from the punctal palpation occurs with duct blockage. So, na-block yung nasolacrimal duct. So, mayroon drainage sa puncta. And then now, ito na, inspect the cornea and lens by shining a light to determine the transparency. Inspect mo na yung cornea. And ito, shine a light from the side of the eye, by an oblique view, side of the eye. When you say side, tingnan mo yung kanyang eye. Is there any? Mayroon ka bang nakikita? Is it clear? Clear. And then the other side also. Now, you can see my right eye. There is opacity because I have ikatawa. So, yan na ano. Dito sa right. Pakita mo dyan mo makikita. Where can you see? That is yung opacity. Katawa. So medyo ano yung aking paningin sa inyo, kaya medyo ang normal sa akin is spine. Yeah. Doon nakakakita ito pero shadow pa rin. Okay? Ito, look through the pupil to inspect the lens also. When you shine the light from the side of the eye to oblique view, pupil ang titignan mo naman. pupil inspect the lens. Tingnan mo yung ano. Ganun pa. Tingnan mo kanyang pupil. Okay, no? Okay siya. Then the other one. So it must be clear. And next, cornea is transparent with no opacities. The oblique view shows a smooth and overall moisture surface, and the lens is free of opacities. So you have seen my lens na talagang meron siyang blacking. And areas of roughness and dryness of the cornea are often associated with injury or allergic responses, and opacities of the lens cataracts. Aking right eye. Before talagang hindi nakakano ito. And then itong left eye ko mayroon din pero hindi pa masyado na ano yung lens. So, dapat sana sa akin is magpapa-opera na sana ako last year. Pero I'm afraid also na magpa-opera. So, ginawa ko yung mga ano sa Facebook, yung mga taking of tablets. Yun na lang ang ginamit ko. So, 3 months akong naggamot na yun. So, stop. Yun. Nagkaroon naman yung activities. Alam niyo naman ang nurses, pag alam niyo na yung ano, ay naku, Diyos ko. You cannot, ano ba ito, pag nararamdaman ka kasi, wala niya, kailangan. Yes, that's true. Pag nurse na kayo, wala nang kailangan. Magagamot lang ako, matatanggal na yan. Pero pag talagang hindi mo na kaya, that's the time that you're going to the doctor. Magpapacheck up ka na kasi iba na talaga. And then, we are now going to inspect the iris and pupil for shape and color of the iris and size and shape of the pupil. So, measure pupils against the chart if they appear larger or smaller than normal, or if they appear two different sizes. Okay. The normal findings, your pupil and iris must be round, flat, and evenly colored. Pupil is centered in the iris, normally equal in size 3 to 5 mm. And your OS means your left eye. Ito, huwag niyong pagpalitin si OS at saka si OD ha. OS, left eye, OD, your right eye, OU, your both eyes. Makikita niyo ito pag mag-duty na kayo, especially sa Opta ward. May OS, may OD, may OU. Kaya wag yung pagbalik na rin si OS at saka si OD. Pag nagpunta naman kayo sa OR, nakita niyo si OS, ay, left eye dajay. No. Pag sa OR, yung OS doon is your operating response. Hindi naman kayo mag-jook talaga po kayo OR, ay, operating response dajay. Left eye mong gayang di okta. So, ganun ito change yung mga ano natin. Kasi medical term ito. OS, OD, and OU. Ano na ba ito yung sinasabi ng abbreviations sa ano na lang. So that doctors will know writing that I kasi Latin words ang mga to. Kaya ito na lang hindi ko ang maano ito sa mga lantis na ito. So, hindi ko kabisado. Kagaya yung ano na ba yun? Kalimutan ko na yung mga ibang words na talagang Latin yung ano nila. Usually doon nang nagaling yung mga ibang medical terms. Okay. So if there is abnormal findings, irregular shape irises, meiosis, decreased pupil size, mydriasis, excessively large pupil, even in brightness, anisocoria, inequality in pupil size or less of less than 0.5 mm first. So, how are you going to inspect the iris and pupil for shape and color of the iris and size and shape of the pupil? What is the iris? Anong kulay ng iris niya? Ah? Are you sure na black ang iris ninyo?
Dark brown. Dark
Which
brown.
is bigger, your iris or your pupil?
Ay?
Iris. Your pupil is at the center of your iris. So, tingnan ninyo, you're going to check now the iris. Okay, tingnan nyo nga kung anong kulay ng mga... Kasi you can see also the color. Hindi naman lahat tayo is black. Mayroong dark brown, may brown,
Blue.
yung sa mga Americans blue, and then there are some parts of the country na green ang kanilang iris. Ang nag-iisang violet ang kanyang iris is pag naano niyo si Elizabeth, si Cleopatra sa American, yun ang violet ang kanyang iris. Siya lang ang nag-iisa.